In connection to what you said earlier, Dr. Rizvi, for the benefit of our viewers, please tell us about what does a medical consultant do and its vital role in the lives of migrant health workers or practitioners. Most especially, there are a lot of Filipinos working abroad, as Sarah also said, as the medical health workers.
There is a kind of hierarchy within the system as far as the UK is concerned, and also in some other parts of the world, whereby the consultant is the top of the tier, and it starts from an intern, which is like a first year doctor who had completed their job, and then they go through the training in various parts. So it would be like a registrar or a specialist registrar, then, and after they have completed certain years of practice, then they pass the necessary exams and proceed on to become the consultant. And what is meant by consultant is a senior doctor with whom the buck stops. So the ultimate responsibility for their own actions as well as the actions of those working under the supervision of that consultant are the trainees.
Consultants. Yes, Doctor or Professor Rizvi, actually I understand that that particular system is also the same as the Philippines, except that for us, non-medical practitioners, we're not very much aware of those terminologies.
Right. Yeah. So terminologies are different, which is like the first rung of the ladder is a house officer, which is the first part of the trainee as soon as they have qualified. Then they become what is called the foundation year trainees or senior house officers, which was the old terminology. Then the registrar, and on to become the consultant. There is one offshoot, I would say, which is like specialty doctors. Now they are the backbones of providing the service element, which is seeing through the patients and doing the necessary things as required. So that is a non-training post, but with some opportunities that can also be converted into a training post, and the option of becoming a consultant is open to them as well.
Now, Professor or Dr. Rizvi, we have seen in your CV that you have over 25 years of experience as a consultant, and you specialize as a locum consultant in emergency medicine. Can you please tell us more about this?
Sure. What it means by being a locum is that that is something which I am by choice, rather than taking a permanent post which puts a responsibility in a fixed way. I have the option of flexibility, so I can concentrate on other things. Let me just briefly give an introduction. Apart from being a consultant in the National Health Service, I have also got a few other responsibilities. I'm also an entrepreneur, so I'm the medical director for a recruitment company which is called the Immediate Medical Solutions. I'm the responsible officer for the GMC UK, which is the registering body, so that is for appraisal and revalidation, and I am on the visiting faculty for teaching on the simulator and AI at University of Cambridge.
Yes, and I'm just wondering, in these various capacities that you are engaged with, I'm wondering how much have you been engaged with fellow Filipinos, with my countrymen in the UK?
Sure. That is something which I've come across as soon as the doors were opened, which is like almost 25 years ago, when one of the first batch of Filipino nurses started coming over to the UK. So there is hardly any department, hospital-wise, and also in the private care and nursing home and care homes, where you would not be able to run a service without the input from the Filipino staff. So they are at all level. And the good thing is that those who came in the initial period have now progressed into senior roles as either, for example, a charge nurse, a sister in charge of the ward. Some have decided to go into management as well. So they're doing really well, and I'm really pleased that they have progressed.